5 penis care rules every older man should follow daily to stay healthy, comfortable, and confident. Have you ever stopped to think whether you're actually following the most important penis care habits that older men should know? For a lot of men, conversations about penis health seem to fade away after a certain age. But the truth is, how you care for this part of your body matters just as much now as it did in your younger years, maybe even more. In this video, we'll go over 5 key penis care habits that older men should practice every single day. These aren't silly tricks or awkward fads. They're straightforward, proven habits that support cleanliness, healthy circulation, comfort, and proper long-term function. By following them, you can stay healthier, more confident, and in control of your body as the years go by. Stay with me until the end, because you won't just learn what to do. You'll also find out why it's important, what might happen if you ignore these habits, and how a few small daily changes can protect more than just your physical health. They can also improve how you see yourself, strengthen your relationships, and boost your overall quality of life. If you've ever noticed something different down there and weren't sure how to feel about it, this might be the moment that gives you answers and the reassurance you've been searching for. So let's begin. Rule 1. Gentle daily cleaning without overdoing it. One of the simplest yet most essential things older men can do for their penis health is to keep it clean, but without stripping away the body's natural protection. As we get older, skin becomes thinner and more sensitive, especially in delicate areas like the groin. If you've been scrubbing too harshly, using strong soaps, or occasionally skipping a rinse, you might actually be causing more harm than good. Good hygiene isn't about aggressive cleaning. In fact, the best approach is the opposite: warm water and a gentle touch. If you choose to use soap, pick one that's mild, fragrance-free, alcohol-free, and without harsh chemicals. Wash carefully, especially under the foreskin if you're uncircumcised. Then rinse thoroughly and pat the area dry. Leaving moisture trapped there can cause irritation or fungal growth in warm, closed spaces. I remember a 74-year-old man named Dennis who struggled with constant itching and dryness for years. He kept switching laundry detergents, trying different powders, even applying antifungal creams, but nothing helped. When he finally visited his urologist, the cause was simple. He had been overcleaning with antibacterial soap twice a day, every day. Once he switched to rinsing with just water in the morning and a light wipe in the evening, most of his symptoms disappeared. The reason is simple. The penis has its own natural balance of oils and helpful bacteria that protect the skin. Harsh scrubbing and strong products remove that balance, leaving the skin dry, red, and sensitive. As the skin thins with age, this natural defense becomes even more delicate. That's why good hygiene in your 60s, 70s, or 80s isn't about scrubbing harder. It's about helping your body keep its balance. And there's another side to this: psychological benefit. Taking a few moments each day to care for this part of your body is more than just infection prevention. It's a reminder to yourself that you still matter, that this part of you hasn't lost its importance. It's still yours, and it still deserves your attention. Even if no one else sees it, you do, and that matters. Done right, daily cleaning becomes a small act of self-respect, setting the tone for your comfort, dignity, and quiet confidence. Rule 2. A daily visual check for any changes. A quick but powerful habit is taking a few seconds each day to look, really look, for any visible changes in the penis's skin, shape, or surface. This isn't about fear or obsession. It's about being familiar with your own body. The earlier you spot something unusual, the easier it is to treat, and the more peace of mind you'll have moving forward. Many older men think that no pain means no problem, but that's not always true. Skin infections, small sores, unusual bumps, or even early signs of cancer can appear slowly, without pain. Sometimes it's a patch of skin that's slightly discolored compared to last week. Other times it's a small spot that feels rough or hasn't healed in a reasonable time. These aren't reasons to panic, but they are reasons to pay attention. Take Frank, a 79-year-old man who once noticed what he thought was a harmless ingrown hair. It didn't hurt, so he ignored it. Weeks passed and it didn't go away. When he finally showed his doctor, it turned out to be an early-stage skin cancer. Thankfully, because he spotted it early, treatment was simple and effective. Frank later admitted, "I never thought to check. I figured if it didn't hurt, it wasn't important. But now I check once a day, no fear, just awareness." This daily check isn't about paranoia. It's about being proactive. A quick glance after a shower or while dressing can give you valuable insight. Over time, it builds a stronger connection with your health and gives you more control. From a medical perspective, it helps detect early signs of irritation, infection, rashes, or growths before they become serious. It can feel awkward to bring these issues up at medical appointments, but if you've been checking regularly, it's much easier to explain exactly what you've seen and when it started. Part of aging well is staying connected to your body, not avoiding it. And now, more than ever, is the time to be aware, not because you expect bad news, but because it's a way of honoring the body that has carried you this far. Rule 3. Moisturizing to protect aging skin. As we age, skin everywhere becomes drier, thinner, and more sensitive, and that includes the skin on the penis. What many men don't realize is that this area also benefits from daily moisturizing, just like your hands or face. It might seem unnecessary, or even strange, but applying a small amount of fragrance-free, gentle lotion or medical-grade barrier cream can prevent dryness, cracking, flaking, and irritation. Avoid products with alcohol, menthol, or heavy scents. Apply after a shower when the skin is clean and slightly damp. Harold, age 82, once told me he dealt with persistent dry patches and irritation that made him self-conscious. He assumed it was just part of aging. Then his doctor suggested adding a pea-sized amount of moisturizer once a day. The improvement was remarkable. "I didn't realize how tight the skin had gotten," he said. "Now it's just part of my routine, like brushing my teeth." This isn't about vanity, it's functional care. Dry, fragile skin can crack, leading to bleeding, infections, and discomfort during normal daily activity. For sexually active men, comfort boosts confidence. For men who aren't, comfort still matters. The absence of irritation is a quiet but powerful, and on a deeper level, moisturizing is a way of reconnecting with a part of your body you might have mentally distanced yourself from. It shifts the mindset from "that part of my life is over" to "I'm still here and I still care." That's not trivial, it's empowering. Over time, it can improve self-esteem, comfort, and even how you communicate about your health. Rule 4. Supporting blood flow through daily movement. Most men don't realize how much steady, healthy blood flow matters for penis health. Erection strength, sensation, and even proper healing all depend on oxygen-rich blood reaching the tissues. You don't necessarily need medication for this. Often, what helps most is simple movement. The penis is part of a larger system. Blood vessels, nerves, and muscles all work together. As we get older, circulation slows down, especially if we sit too much, avoid physical activity, or have conditions like diabetes, high blood pressure, or cholesterol buildup. Light daily movement keeps the blood vessels flexible and functioning. Robert, 76, started taking 2 short walks a day, 10 to 15 minutes in the morning, then again before dinner. After a month, not only did he feel more energetic, but he noticed he was waking up with morning erections again, something that hadn't happened in years. Nothing else had changed. He was simply moving more, and that improved lower body circulation. Movement also reduces inflammation, supports nerve health, and improves blood sugar control, all of which benefit the pelvic area. It doesn't have to be intense exercise. Gentle stretching, walking, gardening, or even standing and marching in place during TV commercials can help. Beyond the physical benefits, movement reminds you that you're still active, present, and engaged with life. That mindset influences how you treat your whole body, even the parts you don't see. The key is consistency, not intensity. Rule 5. Mindful urination and fully emptying the bladder. One of the most overlooked daily habits for older men is making sure the bladder fully empties when urinating. Over time, incomplete emptying can lead to urinary tract infections, pressure on the prostate, discomfort, and even bladder damage. As we age, the muscles that control urination can weaken, the prostate may enlarge, and bladder sensation can become less reliable. You may feel done before you've truly emptied your bladder. Leftover urine creates a perfect environment for bacteria, which can cause infections, urgency, or dribbling. Gerald, 81, noticed he had to urinate more often at night, but still didn't feel relieved afterward. He also started experiencing leakage during the day. His doctor found that he was leaving urine behind each time. Simple changes, taking more time, relaxing fully, sitting down when urinating, and waiting 10 to 20 seconds after the stream stopped, made a huge difference. Sometimes leaning forward or shifting slightly can help release the last bit of urine. These small adjustments can prevent long-term issues and improve comfort. And there's a mental side, too. Being mindful during urination reconnects you with your body signals. It's not just about plumbing. It's about listening and respecting your body's needs. Final thoughts. Caring for your penis in older age isn't about vanity or shame. It's about comfort, health, and respect for a part of your body that has served you for decades. The 5 habits: gentle cleaning, daily checks, moisturizing, movement, and mindful urination may seem small, but together they create a routine that supports both physical health and confidence. Aging isn't about giving up. It's about tuning in to what your body needs. Start with just one habit if you're not doing them all yet. Over time, these simple steps can make you feel better, more comfortable, and more connected to your own body. There's no shame in taking care of yourself. In fact, it's one of the strongest, most dignified things you can do.